Hi everyone, my name is Alaa Elhiraika, and I'm a part of the group that is covering diabetes and its intersection with oral health. We decided on an article that was covering a topic of prevalence, socioeconomic determinants, and associated risk factors of oral parasites and diabetic patients. It was a case control study in Lorestan, Iran. In my group, there is me. My name is Alaa Elhiraika. We also have members Jason Chen, Trace Henderson, Kuna Fonjoe, Jordan Haskell, Ethan Zagore, Paris Ivery, and Mena Estafanous. So our first slide was covering our abstract. I went ahead and did that section. And our main question was, are oral cavity parasites more prevalent in patients with diabetes mellitus compared to non-diabetics? That was the main question proposed in this article. Some of our main findings included there were higher rates of Entamoeba gingivalis and Trichomonas tenax in diabetes mellitus patients. And we also found within the article that there were socioeconomic factors, income, education, location, and also behavioral habits, such as mouthwash usage, that were strongly associated with infection rates.
All right, and I could cover the background. So the main point is that diabetes is a widespread chronic condition that affects not only blood sugar levels, but also overall health, including what we're mostly focused on, oral health. It can make people vulnerable to infections, and like Ala mentioned, the two tiny parasites, the Entamoeba gingivalis and the Trichomonas tenax, are more found frequently in individuals with diabetes than in those without, and they commonly live in or the oral cavity and can cause problems like gum disease and bad breath. So a study was conducted in Iran that investigated the presence of these oral parasites in both diabetic and non-diabetic individuals. The research emphasizes the importance of good oral hygiene and the awareness of the social determinants of health for people with diabetes. Poor oral health can worsen these diabetic conditions, creating a cycle that is difficult to break. And so, by understanding these connections, healthcare providers can develop better and more targeted strategies to improve the health and outcome for diabetic patients.
To summarize, the primary purpose of this study was to investigate the correlation of oral infections and diabetes in individuals. Specifically, the investigators compared the frequency of two oral cavity parasites, Entamoeba gingivalis and Trichomonas tenax, in individuals with diabetes mellitus and healthy individuals. The study also highlights the socioeconomic and behavioral factors that influence the prevalence of parasitic infections and emphasizes the importance of oral education and regular screenings in underserved populations.
So I covered the methods, and for this study, the researchers did a case control design, meaning they compared two groups, 500 people with type 2 diabetes and 500 people without diabetes. All the participants were recruited from Iran between December 2022 and June 2024. Everyone filled out a questionnaire that asked about their age, gender, income, education, where they lived, and also things like how often they brushed their teeth or used mouthwash. To detect the oral parasites, they collected saliva and dental plaque samples from each participant. First, the samples were stained and viewed under a microscope. Then they ran PCR tests to look for the parasite's DNA, which is a more sensitive method. They used specific primers for each parasite and confirmed the results using gel electrophoresis to visualize whether the DNA was present. For the analysis part, they used SPSS software. They ran chi-square tests to look at different group differences and then used logistic regression to see which factors like income, education level, or mouthwash use were actually linked to a higher or lower chance of having these parasites.
So the results found that diabetic patients had a significantly higher prevalence of oral parasites compared to non-diabetic controls. Using microscopy, 27.2% of diabetic patients tested positive for at least one oral parasite versus 12.2% in the control groups. Using PCR testing, the rates increased to 29.2% and 13%, respectively. Most common parasite was Entamoeba gingivalis, found in 69.2% of infected diabetic patients, followed by Trichomonas tenax in 33.1%. These results show that diabetics are nearly 3 times more likely to carry oral parasites than non-diabetics. Surprisingly, though, toothbrushing alone did not reduce risk, but regular use of mouthwash was strongly protective, reducing infection odds by over 90%.
So further discussion, based on the main results, these results signify that there is a notable relationship between people with DM having higher tendencies to acquire periodontal disease and other oral health issues. But this study also took a deeper look into the intersectionalities of socioeconomic factors that play a role in oral health as well. So examining the differences between men and women, it was noted that women tend to have better oral hygiene habits than men overall. However, the p-test showed no significant difference in terms of infection rates. Other social and economic factors did show a significant impact nonetheless. For instance, people earning less than $600 a month were 6 times more likely to be infected than those who make more than that. Additionally, illiterate individuals held about 3.5 times the risk of infection compared to those with at least a high school diploma. And a notable but possibly surprising statistic was that diabetic patients living in cities were twice as likely to have the two parasites compared to those living in rural areas. Usually, cities have more accessible healthcare facilities and dental clinics, especially within a closer range. However, overcrowded living situations, higher levels of pollution, and stressful lifestyles may have also contributed to the poor oral hygiene statistic. And altogether, these results expand our understanding of oral parasitic infections on diabetic populations. Yet, like all studies, it's still subject to limitations that warrant discussion. For the next slide.
So some limitations of the study is that if that causes oral parasites, it shows a link. It was also done in one area of Iran, so the results might not apply to other places. Some information like brushing and mouthwash was self-reported, so the information might not be as accurate. The study also does not consider other factors like diet or dental visits. And the biggest limitation of the study is that they only researched people with type 2 diabetes. Future research should include more diverse groups and explore other risk factors and test whether oral care can prevent these parasites in diabetic patients.
Finally, we quickly want to touch on the relevance of the subject. As future healthcare workers and professionals, it's always important to know the purpose of our interests. In this case, we looked at a common risk for oral cavity parasites, particularly in lower to middle class or middle income nations where healthcare is a bit more scarce, such as Iran. This research acknowledges the increased risk of oral cavity parasites in patients who are also diagnosed with diabetes mellitus. With diabetes mellitus being such a prominent condition at this point in the world, it's useful to know the correlation between it and oral cavity parasites.
This is just a slide with our references. We want to go ahead and thank you all for listening to this presentation, and we hope that it was very educational and that you learned something from this. Thank you all and have a wonderful rest of your day.